My name is Professor King David Tenaya, the President, West African College of Surgeons. We're here in the beautiful city of Banjul, the Gambia, for the 50th Annual Conference, Scientific as well as General Meeting of the West African College of Surgeons. For this meeting, the theme is Global Surgery Implementation for West Africa. We are in the Gambia for this conference, the third time we are in this very great nation, one of the founding nations of the West African College of Surgeons in the 1960s, because we want to first and foremost celebrate with the government and people of the Gambia for really practicing what is called democracy, their resilience, their courage and doggedness to be able to stand as a nation has impressed not just we in West Africa and Africa, but also the global community. Secondly, we're here in the Gambia to deal with some of the issues that we have worked out in our Strategic Development Plan 2017 through to 2021, which is to ensure that we key into the global health agenda as propounded by the World Health Assembly 68, as well as the SDGs, and perhaps more closely related to us, the relevant sections of Agenda 2063 of the AU. And this is very important because every aspect of measurement of health indices, Africa, and particularly our segment of the Sub-Saharan Africa, carries some of the poorest indices, whether you are dealing with manpower, infectious diseases, and unfortunately in the recent years, even non-infectious diseases have begun to show that we are not doing very much. Number two is that our capacity building in the sub-region, although we started quite early in the 60s trying to build capacity, we are building capacity. On paper, it looked impressive, but in practical terms, 3/4 of the manpower we actually develop in Sub-Saharan Africa is exported to Europe and Americas. So it starts over in every aspect of health care provision. One of the things we are going to do about in this meeting is to look at the multifaceted challenges of providing or implementing healthcare agenda in the sub-region. I'm very happy that at the opening ceremony already we began to look at some of those challenges. We're looking at healthcare financing, which is a critical element. Most nations in this sub-region, although they parade on paper some form of national health insurance, in practical terms, the national health insurance is just for less than 5% of the population. These are some of the reasons why, as a subcontinent, and we know disease has no geographical barriers. Ebola in recent years has shown us that what happens to one has happened to all. So we are pulling our resources together, and we are pulling our manpower together. We are pulling together our training facilities, and we hope that when we are very well organized, then collaborators and partners will also be happier to work with us. So this conference is going to deal with some of those issues. And that is why we have assembled a team of participants, key providers of or resource personnel in this, from the AU itself, from WAHO, which is the West African Health Organization, and from the UN agencies of the UNFPA, as well as a number of others. But we're also here with another set of people in Europe and America, large companies dealing with surgical and medical equipment as a whole, that they partner with us. And in fact, I can say that one of the things we want them to do is to make available locally for us. It's a key element, to train people in our environment. So if we train them in our environment, we may lose some, but we won't lose only a very small proportion. We have seen this work in East Africa, East and Central African states, where nearly 70% of the trainees because they are trained within the sub-region and in the localities, are able to retain their jobs and are comfortable with the environment in which they are working. So that's in a nutshell, some of the things I want to do here. And we want to advance another very important concept of implementation of Agenda 2063 as far as health is concerned. Globally, the world is looking forward for how we can develop platforms, surgical systems that deal with emergency and essential surgery. So essential surgical coverage, we have decided in West Africa to break it into a number of segments. One is that we have a general outreach for treating patients, which we undertake at our annual conferences. You can imagine if we're going to use that alone to cover West Africa, it's impossible in this century. So we have propounded and we have now started implementing our strategic plan, the concept of regular surgical outreaches in the rural areas, and especially in troubled spots. As you're probably aware, in the north and in disaster-prone areas, as you're probably aware in Nigeria, because of the insecurity, a number of people have been pulled together in almost a quarter of the nation in one place. And we are covering that area with systematic approach to provision of surgical care. In the past 3 months, we've been able to treat about 11,000 patients and perform over 2,000 surgical operations. And that is just round one. And I must say that these are areas where we have a core strength of the manpower, but we don't have the finances. And so we are now partnering with a lot of people. We are partnering with NGOs, local as well as international NGOs, to enable us to achieve this objective, to ensure that at least to some extent we will be meeting the target of universal health coverage for a sizable proportion. Now we know that as we do this, many more people will buy into this. You know, we need to be human beings. It's one thing to be human beings, and it's another area to be human. Our core competence enables us and makes it necessary for us to be human. So the humaneness in us is what we're trying to display by just giving back to society. The third most critical element of this plan is to build capacity. And the capacity is not just about surgeons. We're building capacity in various aspects of surgical care delivery. And we're partnering with several others in the health profession. We have launched the West African Surgical Plans Committee. It's not about surgery, it's about healthcare. And in this, we have nurses as a critical component of healthcare delivery. And we want everyone involved in making sure that the sick are looked after to be part of this whole body. So we have engaged the West African College of Nursing. And in Nigeria, for example, we are centering these surgical plans in the ministries of health. If government is not agreeable to this, it won't work. So we are fortunate that the AU has already provided a framework in which all governments in Africa are in this. What remains now is to take this to the grassroots. And the West African College of Surgeons is in the business of working with organizations, WAHO, as well as regional governments. And I must say this, that in the past 6 months of our interaction with the Honorable Minister of Health of the Gambia, seated right here with us at this conference, we have received tremendous support in trying to build this kind of capacity and build this kind of framework that will take healthcare delivery to the grassroots.
Good afternoon. My name is Safilo Sise, and I'm the Minister for Health and Social Welfare. Well, the conference came at an opportune time for me because we inherited an ailing health system, poor infrastructure, lack of human resources, and all the things that he mentioned that we need, we don't have. We've lost most of our competent people. There's somebody sitting there. Why? Because of non-conducive working environment. People had to just run away. I'm happy that the coming of the West African College of Surgeons in the Gambia during my time will provide us an opportunity to look at our system and how we can improve on them. They've started by trying to accredit the teaching hospital, which is the Edward Francis Small Teaching Hospital, which is our main referral hospital, and if not the oldest, the second oldest in the country. So we are trying to revive that, train our own people. We have a cohort of doctors with just general practitioners, no specialization. And them coming in will address that gap. So this is one very good aspect that I'm very hopeful for. And like I said, we're trying to give them all the support we can. The government is young, with a lot of ups and downs, not strong financially like many African countries. But I know, like they said, if we work together, we work far. So I believe that together, the sub-region, African sub-region, we can make strides. Thank you. I'll stop that for now.
Thank you very much, Honorable Minister, and my good professor, whose name I find interesting, King David Turner Yahweh. If you have any biblical corrections, it tells you a whole lot, and he has lived up to his name. We're extremely happy to be here on the Smiling Coast, in the Gambia here in Banjul. Very warm welcome given to all of us, for which we want to thank His Excellency the President and the government and people of the Gambia. Gambia has been in the news lately, and it's been in the news for a very good reason. And the Gambia has inspired all of us for what they have been able to achieve. As I had said in my earlier statement, what has happened here is a democratic revolution of gargantuan proportions. And it sends a message to everybody about good governance, about truth, about justice, the rule of law, and the sheer immensity of the power of a determined people. So we here are very happy to be associated with this. Maybe you may have heard I had originally intended to read medicine and chemistry practicals in Achimota. My equipment just went haywire, my test tubes collapsed, and I was advised discreetly by the headmaster to go and find something else to do. And through that, perhaps the world at large has been saved a potential menace. But here I am now, happy to be associated with you, members of the medical profession, because your profession is so fundamental to all of us. We need healthy people to build an integrated and developed Africa. It means that we must have education for everybody. We must emphasize scientific education and also revisit our African cultural curriculum, because we're coming from a long way. We are eagles who have been taught to think like chicken. We have to reach back to our roots, the better for us to go for it. So, in a word, I just simply want to thank His Excellency the President of the Gambia and all the great people of the Gambia for making us so proud as ECOWAS. And this message has reverberated the world over. And it is in that spirit that we are extremely happy to be here and to engage with you, gentlemen of the press. Thank you very much.
We've seen that the recently concluded AU summit in Addis Ababa mainly focused on corruption and Africa standing on its own to be able to do things without interference from the West. How is that critical to this summit currently held in the Gambia?
I'd like to thank you for a question of this nature. It is very fundamental and very key to our operations. You know, if Africa is to stand on her own, Africa needs to combat corruption, through which over $50 billion is lost to the continent every year. If you're able to retain amounts of this magnitude and use it within the continent for our self-development, we should be able to finance medical education, medical treatment, medical investigation for everybody, for every child. We should be able to have every African child in school and remain in school. We should be able to avoid a situation where our young people, out of desperation, are voting with their feet, crossing the Sahara on foot, getting drowned in the Mediterranean, to the lamentable disgrace of all of us. So this is what anti-corruption can do for us. That is why we put a very great and eminent African, the current president of Nigeria, who we all know for his very straight and very incorruptible ways to champion the anti-corruption drive, the effects will be far-reaching. Thank you for your question.
What were some of the strategies or policies in place to fight corruption?
You know, corruption between two consenting adults who do not want everything to come to light thrives under an opaque legal system. The key then is for more transparency, more cleaner governance, more prosecutorial powers, a greater and transparent rule of law. That is the key. Because people who do corrupt actions face transparency. They do not want to see the light of day. So the key thing is to have procedures which are clear, transparent, publicized, and a system where whistleblowers are encouraged and are credited for what they're able to do. But it depends on everybody standing up for your rights and being aware that truth will ultimately prevail. Thank you.
Good afternoon. My name is Mariama Bojang, and I'm from Paradise FM. Since the inception of the African College, West African College for the Surgeons, what were some of the most success story of your organization? And of course, how interconnected is these countries that are involved in this organization? How do you help each other when it comes to critical conditions?
Thank you very much. I must say that the surgeons were very political before the politicians took over. We came together as West Africans before the political leaders began to bring Africans together. So we've been dealing with that. It's a very strange arrangement to have the Anglophones. The first 4 Anglophone countries were Nigeria, Ghana, the Gambia, and Sierra Leone. They first came in, then Liberia joined. And then we brought in all the Francophones to join us. And in the spirit of this, we exchanged leadership. So it's not only the Anglophones that run this. We go from one nation to another every year to promote our oneness. We have harmonized our training programs and our curriculum for training between the Anglophone and Francophones. We exchange examiners at all the examination levels within the Anglophone and the Francophones. And I can tell you that we do our business also as much as possible in a bilingual fashion, so no one is left out. We have accredited training institutions within the Anglophone and Francophone nations. The Francophones also benefit from us. We too benefit from them. So the integration is actually very much, and it's an agenda we have continued from the beginning, and we're advancing it this moment. We attend purely Francophone conferences, and they attend our conferences as well. When we get to member nations, we ensure that we offer services, free services like the surgical outreaches, and we also propound theories, or rather advice on how health services within the member nations can be done. We also operate as a group for ECOWAS countries through the WAHO. And WAHO is a West African Health Organization. And so the agenda of health, as charted by WAHO, get a substantial input from the West African College of Surgeons, among also the other West African colleges, the physicians, the pharmacists, and of course the nursing. So in this regard, there is really a good form of West African integration within us. And I want to remind you that the West African College of Surgeons was the first college. In fact, it gave birth to the West African College of Physicians. And subsequently, the nursing and the pharmacists also picked the queue. So we are like the beginners of the program of this integration. And like I said, we haven't reached the point of integration. When we are complete, then there will be enough trainers in the Gambia, there will be enough trainers in Sierra Leone, there will be enough trainers in Liberia, every other nation within the ECOWAS subunit. When it becomes like those who are top, then we know that we have completed integration. But it's work in progress.
My name is Omar Ba from the Standard newspaper. My question will be for our minister. You talked about, the difficulties in the health sector. We all know how much corruption have impacted on our country over the past 22 years. This is a new government that has given a lot of hope to Gambians. When it comes to health, actually, it should be the first priority, because when a country is not healthy, there cannot be no development, because we cannot work. I just want you to briefly tell us how does your ministry and government intend, to remedy the situation in the long run.
Yeah, this is what I started when I introduced myself. The coming of the West African College of Surgeons is one way of addressing that. Because if you know, training a doctor locally, just general practitioner, as opposed to taking that person overseas for training, specialization, the amount of money that it costs, government cannot fund that. At most, sometimes we have at least one person or at most two people that we send overseas for specialized training. And how long would that take for us to have the cohort of the specialized doctors that we need? That is not sustainable. So with these people coming in, training locally, the training will be done locally. At the same time, they will be offering services to the public. That is one way of trying to address that. Exchange programs will also do that. We have trainers come in, attract a lot of people, train them, as opposed to sending one by one, which is not sustainable. But when you talk about corruption in the health system, we all know how it is. We have these young doctors that will just go and practice in the private sectors. Some open their pharmacies with the resources that we have, that they take out to get some money. So I think we're trying to get people to know that government alone cannot make the system move or cannot make any change, meaningful change. Because we, ordinary people, form part of the government, a very important part of the government. So we must learn to be individuals in our own right, be respectful individuals for that matter, try to ensure that the little resources that we have are used in the most judicious way. That is one way we can fight this. No matter how much training we have, if you don't change ourselves, we cannot make anything meaningful. The hospitals, most of them are in a deplorable state. But we have very good doctors, notwithstanding. We have very good doctors. We just have to inculcate good citizenship, good, how would I put it, for want of a better word, for people to know that development in any form has to come from us as citizens of this country. Thank you.
My name is Abakar Sise. My question will go into the minister. You've talked about the unfavorable working condition at our various health centers. What are some of the strategies do you put in place to make it viable for some of the health practitioner workers in order for them to stay in the system?
You know, before my appointment as minister, I was the permanent secretary for the Ministry of Health for close to 16 months. I had the opportunity to go up country. And the first thing that I lamented was the living conditions of the doctors. Because any ordinary person at the end of a day's work, one will think that you'll go to not a place that has all the basic things that you need, but the basic minimum requirements for you to be able to rest and prepare yourself for another day. But this is not the condition. And I've known monies have been given for the refurbishment of most of these buildings, but it went into the wrong hands. So that was the first thing that I made the government aware that we have to give them very good, conducive places to live at the end of a day's work so that at least they'll be fit for the next day. So these are some of the very small but very important things that we really have to take into consideration. And most of our doctors are young people. When you frustrate them like that, you take them up country without even a television or whatever, the slightest opportunity they have, they run. They go elsewhere. So we have to ensure that we give them good houses, better working conditions, and encourage them. I don't believe in giving them money to go. I don't believe in that. Because the health profession calls for more than, you give more than you can ever be paid. You give the best part of your life to other people. So that cannot be compensated. So I think give them the respect that is due to them, give them good, decent living conditions. And I think the work will have been done halfway. Thank you.